On this episode of the Dairyland Initiative podcast, we're going to be talking about troubleshooting respiratory disease in calves. Hi, I'm Courtney Hallbach.
And I'm Nigel Cook.
And this is the Dairyland Initiative podcast,
where we get to discuss issues related to the housing and management of dairy cattle.
Let's dive in. Well, welcome everyone. We are very excited to have our first guest of the podcast, Dr. Terri Ollivett. She's a colleague of ours here at the Food Animal Production Medicine Group in the School of Veterinary Medicine, and I've had the privilege of working with her now for 10 years?
10 years, 10 and a half years.
My, how time has flown.
Seems like overnight.
Yep. But Terri, could you give us a little background about yourself?
Sure. I came to Wisconsin, Courtney said, just a little over 10 years ago. Prior to that, going way back, I actually graduated veterinary school in 2004 and in New York, where I am originally from. After vet school, I practiced in a mixed animal practice for a few years and then kind of got the itch to go back and do some extra training. So I did a large animal internal medicine residency at Cornell, and that's where I got my introduction into doing kind of really practical field-based clinical research based on calf health, and kind of also got introduced to this idea of epidemiology and recognized how mixing herd level medicine and the population medicine tools with individual animal medicine was really kind of a cool way to go about things. And so once I finished internal medicine residency at Cornell, then I went on and did a PhD at the University of Guelph in population health. And it's during that program that I got to focus on validating the use of lung ultrasound for diagnosing pneumonia in dairy calves. So since then, since coming to Wisconsin, it's really been my focus is figuring out how we can better raise these young dairy calves, better manage them so that they perform better as adult animals. So big focus on that is going to be the correct identification of disease and figuring out what the risk factors are for those diseases within a specific herd.
Well, that's excellent. And I think, what you have brought to the University of Wisconsin has been phenomenal. And you've done so much great work working with calves out in the field throughout Wisconsin, the United States, and the world. And so I want to piggyback off of your knowledge. And first of all, I was getting sick of Dr. Cook sitting over there all the time. It's been 20-some episodes of just hearing Dr. Cook talk. But we have spoken about calf barns and raising strategies in the past and ventilation. And now, one of the big questions that I get a lot from people emailing me has been about respiratory disease. And as you're aware, when you hear respiratory disease, you usually think of ventilation and air quality. And as the ventilation person here with our group, I can do a lot and I can make it pretty darn good. But if there's other things that are broken, ventilation isn't going to be the cure-all. And so that's why I thought bringing you in for a podcast to talk about some of the clinical and subclinical disease factors behind respiratory disease would be helpful for our listeners who may be troubleshooting things in their existing barns or thinking about building new and wanting to do things right for the calves.
Yeah, so I think that you're spot on. Ventilation is always something that comes to the forefront of owners' minds, of veterinarians' minds when they're dealing with a presumed respiratory disease problem in young calves. And over time, now that we have better tools to diagnose respiratory disease, really we're figuring out that there's a lot more to it than just the air quality. It is never a bad thing to bring fresh air into a barn.
And
right?
I 100% agree with that, Terri.
Never a bad thing. I'm channeling my inner Dr. Nordland. It is never a bad idea to bring fresh air into a barn. But if there are other underlying risk factors, it's not going to solve the problem. And if the disease that's actually happening isn't truly respiratory disease, if it's something that's mimicking respiratory disease, then you're also not going to solve the problem. So a big point that I want to get out during this podcast is how important it is to truly characterize the condition that you're dealing with. Whether you feel like it's an uptick in perceived respiratory disease. So maybe there's more coughing or more antibiotic treatments given for respiratory disease, or a true outbreak where you go from not having any disease to having a whole bunch of disease. You've really got to have a case definition and really figure out who is affected. So what age are those calves when they are getting sick for the first time? Is it happening to a certain subpopulation of animals in your facility? So is it heifer calves? Is it bull calves? Is it everybody? Is it just your Holstein calves? Is it your Holstein and your crossbreds, or just the crossbreds? Or maybe you've got Jerseys too, and it's only the Jerseys. Figuring out which population of animals are most affected. I put location on the slide here just to have tucked in the back of your mind. A lot of folks tend to think that this one part of the barn is bad, right? This part of the pen or this part of the barn. Oftentimes, it's actually an age-related association. So all of the 10-day-old calves travel through this part of the barn. It feels like it's that back corner of the barn, but it actually has more to do with the age than that part of the barn. So I put that in there. It is important. It could be a significant piece of the puzzle, but I don't want people to get caught by the red herring thinking that there's something wrong with this part of the barn or with this barn when it actually just happens to be an age-related phenomenon.
Yes, and I'm guessing that data would be really helpful for some of these things, because it's very easy to say, well, this group of calves is all sick, but without having data to back it up, how, as a veterinarian or a consultant, how can they help?
Absolutely. You need data to do a really good job at this. Otherwise, you're just kind of shooting from the hip. The same thing with weather implications, right? Obviously, we know weather changes day to day, but paying attention to those weather patterns, curtain management, that type of information can also be helpful. And also help you plan from the weather perspective. We know these calves get cold stress very easily. We're all used to seeing upticks in disease during the wintertime, but we can fine tune better. We can really figure out, okay, at what point do I really need to get aggressive about my cold stress prevention? Because it's going to happen earlier in the life than you think it probably does. Earlier in the fall, later in the spring, and you can prepare for that from season to season.
Yeah, really. I know I hear a lot from clients that seasonality plays a role in when they are seeing these upticks in respiratory issues.
Yep. And it might be something as simple as being really aggressive with your straw bedding for the first 10 days of life to really protect that newborn calf and keep that first week, 2 weeks, 3 weeks of life really as stress-free as possible, to hopefully mitigate any increased risk of disease that's going to happen after that because of that cold weather.
Yeah, excellent points, Terri.
So in addition to those specifics that I mentioned on the previous slide about characterizing the condition, we want to really figure out what actually is the condition. Do these animals really have respiratory disease? Do they have pneumonia? And so we can use our clinical exam, we can use lung ultrasound to help classify whether or not these calves have subclinical disease or clinical disease when the disease starts. And the reason that's important is because many times, at least here in the Midwest and the Northeast, where I've spent a lot of time looking at a lot of calves, if it's just the true bacterial respiratory pathogens like Pasteurella and Mannheimia and Mycoplasma, oftentimes those calves are subclinical at the beginning of the disease process. So they develop these lung lesions first, and then a week or 2 weeks or longer goes by, and they develop the clinical signs that we attribute to respiratory disease.
And what are those clinical signs?
Like the snotty nose, the droopy ears, the coughing, the breathing heavy, the depression. More often than not, again, if it's just those respiratory pathogens that we're used to, Pasteurella, Mannheimia, Mycoplasma, usually when they first get pneumonia, they act totally normal, completely normal. But if you characterize disease in these calves and realize that they look sick, first they really do look sick. They have snotty noses, or they have fevers, or they're breathing heavy, or they have a cough. There could be something else that's mimicking that condition, like septicemia or a salmonella infection, that is contributing to the disease process. And we handle that a bit differently. So knowing, are they clinical or subclinical when disease first starts, it's helpful. And then having the ability to use a lung ultrasound. So it's becoming more mainstream. It's becoming more common that veterinarians are trained now to use a lung ultrasound to diagnose pneumonia. They can characterize the lung lesions in these calves. And again, if we have very sick looking calves, let's say they're 14 days old, they look visibly sick, but their lungs are relatively unremarkable on the ultrasound, or they have maybe small, mild lesions throughout the lungs. That kind of supports this idea that maybe those calves have septicemia and they don't truly have a pneumonia secondary to Pasteurella or Mannheimia or Mycoplasma. Or if they're, say, older calves in the pre-weaning phase, maybe they're 4, 5, 6 weeks old, and again, looking very sick, but their lungs are relatively unaffected, it again points to more of a sepsis problem and less to a primary respiratory disease problem. So it's helpful because it's going to change,
what direction you
exactly
go. And
right.
I'm kind of hearing two separate roles of the veterinarian here as well. So there's one where the veterinarian is more taking preventative measures by doing the lung ultrasounding, looking for those subclinical symptoms, and then there's also a time when you are seeing these clinical symptoms and the vet should come out. So, as a farmer, what is a good time to bring the vet in to help troubleshoot these issues?
Yeah, I think any time that you feel like you're seeing more disease than you're used to, it's time to have somebody come out and take a look and see what has changed in the system. What can you be doing differently to prevent disease moving forward? For those operations that have a pretty steady level of what we call endemic disease, meaning that it's not super high, but it's not zero. It's just a level of disease across the course of the year. Those cases tend to be more subclinical in general. And in those situations, that's where we see farms and their veterinarians actually doing routine scanning, routine visits every week or every other week to identify and treat those subclinical cases. So there's a couple of different scenarios and situations that happen that drive how you're using your veterinarian in that situation. So it's, whether or not you're going to be just identifying this current, what feels like an uptick in disease, or you just in general aren't happy with the level of disease in your calves and you're going to be doing routine, consistent monitoring.
Got it.
A really important point I want to bring up is that when you are characterizing disease and you're focused on the respiratory side of things, we have to really pay close attention to other body systems that could be involved. Mm-hmm. And this means characterizing gut health by looking at manure, quality of manure, and looking at diarrhea, and looking at navels and looking at joints. So when you start looking at these things, when you start actually putting your eyeballs and looking at manure production, looking at the navels, feeling the navels, we recognize that there's a lot more abnormal manure that's happening out there that goes undetected because generally the calves are still eating and drinking and acting okay, right? Yeah. But that abnormal manure is a red flag. That tells us there's something going on, that's something wrong. And when these calves have abnormal manure, they are more likely to get pneumonia. So if we want to reduce the frequency of pneumonia, we have to reduce the frequency of diarrhea to do that.
And what would an abnormal fecal sample look like to you?
Yeah.
Just walking through the pens.
Yeah, so walking through the pens, in my mind, I'll start with what is normal. So I expect calves, and I'm talking young pre-weaned calves here, between birth and let's say up to 21, 28 days of age. Diarrhea in that age range is what's most likely going to lead to pneumonia in the following week or 2 weeks. So a normal manure in that age animal is going to be pasty. If you had it in a cup, it would stick to the side of the cup, and if you tip the cup over, it would not slide down the side of the cup at all. It would just be kind of pasty and stick there.
Sounds like a good milkshake, like solid. Sorry.
Let's go to Culver's. So then kind of the next step, so that would be normal. Mildly abnormal manure in my mind is going to be if we had that manure in a cup and we tipped the cup on its side, it would slowly run down the side of the cup. It'd leave a really thick residue behind. It may have more mucus in it than we're used to seeing. So it's not watery, it's not super runny, but it's not that thick pasty manure that sticks to the side of the cup. And then what I would consider severely abnormal manure would be that watery manure where you have it in the cup, it's just liquid, you pour it, pour the cup to the side and it just runs right out. It leaves a very thin coating on the side of the cup. So I don't think we really need to bend over backwards to decide, is it mildly abnormal or is it severely abnormal? In my mind, abnormal is abnormal, and we see that it contributes to abnormal lung health in those animals. So it's important. And again, emphasizing that most of those mild cases don't get documented, right? Maybe those calves get electrolytes, maybe they don't. Even the severe cases, if they're still eating and drinking, a lot of times it doesn't get documented. So until you go and look at it with your own eyes, either you as a producer or as a veterinarian, you don't have a true handle on whether or not gut health is contributing to your respiratory health. And the same with the navels, right? Navels are very hard to see from outside of the pen when they're abnormal, and you really have to get your hands on them. And so if you're doing clinical exams to evaluate for respiratory disease, you've got to reach down and palpate that navel. What I find over the last few years, there are a lot more navel infections than I ever expected once I started putting my hands on all of these navels. And many of them are not that dramatic. Many of them, there are two problems with navel infections, or two manifestations, I should say. You have these large external umbilical infections that feel like an abscess or a big swelling on the outside of the calf. Those are bad, right? But what's actually worse is when that infection travels into the abdomen of the calf through those umbilical structures, those fetal remnants. And there are remnants that go forward to the liver, there are remnants that go back to the bladder. And when those are infected, that increases the risk of septicemia, that there's going to get bacteria translocated from that infected umbilical remnant to the liver or to the bloodstream. And that's when the calf ends up with septicemia. They might end up with liver abscesses. They end up with more problems. And interestingly, those calves that have those internal remnants infected, oftentimes it's not very exciting on the outside of the calf. It may just be very slightly enlarged, very slightly painful. Maybe there's just a very small amount of discharge. You can't pick that up until you put your hand on the umbilicus. And those umbilical stumps tend to be very short. So if you're walking by a calf that's maybe 14 days old and all the calves around it have a long, dried umbilical stalk that's there ready to break off, the calf that's missing that umbilical stalk, those tend to be the ones actually that I find are more likely to have that internal structure infected. And I don't understand necessarily the mechanism behind that unless it's being torn when they're, a neonate and that's driving some infection or what's happening. But that's something that I've been picking up. So when you're working, whether you're a veterinarian or you're an operator that's trying to get on top of calf health, really pay attention to those navels, because I think they tell you a lot more information than what we've gleaned over many years.
That's a good takeaway.
And whether it's sepsis or navel infections, joints tie into this as well. They can point you into a different direction when you're troubleshooting. So if things are pointing the direction of septicemia versus just straight up pastoral or respiratory disease, then we really are thinking these are probably younger animals that have disease. We've got to really start thinking about what's going on at birth, first couple of days of life, maternity management, and because something's happening, something's going wrong or really early in the life of the calf that is setting them up for diarrhea, naval infections, joint infections, and septicemia. Then the respiratory disease comes. That's the end of the road after all of these problems. So the big picture here is that don't get hyper-focused in on this is respiratory disease. It probably is, but it might not be. In many cases that I've been working up, it's these other conditions that are actually mimicking respiratory disease. So, and if you really want to get on top of being able to prevent the respiratory disease, you've got to figure out all of those things that are broken before the respiratory disease starts.
Yeah, I'd say that's what are the things that are broken. When we were talking about this episode, that was one of the key factors you want to get across. So.
Yep. Absolutely. The last component to characterizing the condition, I got a little sidetracked there and talking about all of these other things that contribute to respiratory disease. But the other part is understanding if animals are dying, who is dying, how old are they, how soon or how late after their initial respiratory event occurs are they dying? And are you seeing any response to treatment during that process? In some cases, especially if sepsis is the underlying culprit and it's not a true primary respiratory disease problem, usually we'll see that there will be a higher level of animals dying, more animals dying, but it takes them a while to die. It's not immediate. So maybe they get sick when they're 14 to 18 days old with that initial event, and then they just kind of smolder for weeks and weeks, and it might be around weaning, or even sometimes I've seen after weaning that they end up dying just because they, at that point, are so chronic.
Are you seeing that with calves that have respiratory disease, though? When are they dying?
So straight up calves with just a pasteurella respiratory disease, very few of them die, right? So it's a very low level of animals that die from just straight up respiratory disease.
So that if you have a lot of calves dying, you're not looking at it as that might be
it's a signal
factorial
that
thing,
there's
but
something else going on, that it's not just plain old respiratory disease. Yep. There are some bacteria that we would call hot, right? That goes through and really wipes out the animals. But in these calves, it's not very often that we see that, right? If it's just a pasteurella pneumonia, they tend to smolder, and not very many of them die from it. It's when we have salmonella involved or some other form of septicemia involved that we see high mortality rates. So again, it helps you kind of figure out what direction you're going to go in. And once you have that picture all put together, right, and you understand the comorbidities that are involved, and you understand, is this really just a pneumonia problem, or is there some other underlying condition that is predisposing these calves to pneumonia, then you can go and look at those risk factors. And the risk factors, I think there's nothing new that I'm going to tell you here, right? It's about passive transfer, high quality nutrition, an environment that is going to be conducive to good fresh air, no overcrowding. I put social factors up here on the slide, right? Again, there's some work out there showing the benefit of pair raising. We don't want to overcrowd. Small groups are good. Big groups are probably bad. How well we can clean the bedding, all of those environmental factors, the biosecurity component of it. There's a big list behind me on the slide of all the nitty-gritty little things that we can look that we can look at, which the viewers can't see because the font is so small. But the big point is that when you figure out who is affected and what are they affected with, then you can go and tailor your investigation to look at the potential risk factors. If I have disease that is a primary respiratory disease that's happening in 6 or 7 or 8 week old calves or even older, it's probably not a passive transfer issue. It's probably not something that's happening on day one of life, right? And so it's helpful to get the full picture to help you in your troubleshooting.
So in a quick summary, if somebody is reaching out to you or their veterinarian saying, hey, I have respiratory disease, what are some of the key takeaways or questions that you want to know to see if it really is respiratory disease?
Yeah, so get it characterized, figure out what the lungs are doing. Are they abnormal, which suggests that it is a component, that it truly is respiratory disease, or is septicemia involved? Figure out who is affected, and then figure out, okay, what are my risk factors for that population of animals, right? If it's very young animals, then you're going to really lean in on passive transfer and early life nutrition and gut health. If it's older animals, you're going to focus a bit more on the environmental side of things, overcrowding in the pens, access to high good quality nutrition, the ventilation side of it, and then figure out which one is going to have the most bang for the buck, right?
Yep.
So figure out what is going to be the most important thing to fix first, but usually recognize that I haven't seen a silver bullet yet. You haven't seen me mention the word vaccines yet.
No,
right?
I have not.
Because it's usually these other factors that are so much more important. I'm not saying there's not a place for vaccines, but if you don't have the underlying management in place, you're just going to be battling, and it's an uphill battle.
Yeah.
So I think that's where I would go with my advice.
Well, it's great, and it sounds a lot like a program you've created called Wean Clean, which is available on the Dairyland Initiative website, talking about your Wean Clean philosophy and ways to implement lung ultrasound on farm.
Yeah, yep. The Wean Clean is just this idea that if we can get calves to and through the weaning process with nice ultrasonographically cleaned lungs, they will handle that transition better and be better performers in the post-weaning period. So if we are not getting calves to the weaning period with clean lungs, then we're doing something wrong before then. And this program helps you tailor your strategy to figure out when and where the problem is showing up.
Well, thank you so much,
You're
Terri.
welcome.
This
Thank
has
you
been
for having
great.
me.
I think Dr. Cook should be worried about losing his seat as a co-host on this podcast.
I don't know about that. But
But thank you, everyone, for joining us. I hope you found this podcast valuable as much as I did.
Thank you, Courtney, for having me.
Thanks. The Dairyland Initiative is supported by industry leaders who are advancing cow comfort worldwide. We would like to say a special thank you to our premier sponsor, Saputo, who is providing the global community with high-quality dairy products made from high-quality milk from healthy and well-cared-for animals. We'd also like to say thank you to our other sponsors, SaveCows.com, Zinpro, GPS Dairy Consulting, 40 Barn, Sure Gain Trow Nutrition, Munters, J&D Manufacturing, VES Artex, Ventec, and Kestrel Instruments. Thanks for tuning in to the Dairyland Initiative podcast. Want more Dairyland Initiative? Be sure to subscribe to our podcast, follow us on our socials, and visit our website for all of the latest recommendations in dairy cattle housing and management. See you next time.